Big hand.
Well, good afternoon all, and thank you very much for this great opportunity to pitch for the future of dermatology. I know presentation slide looks a little odd, but please bear with me. So today at this pitch event, I have not brought to the table a single dermatologic agent, but rather a technology that can bring a paradigm shift in the field of dermatology, namely therapeutic molecule systemic delivery technology. Of course, there's a lot of challenges in the field of dermatology, but one of which, perhaps the most important one, is the delivery. The poor drug penetration in the field of dermatology not only causes inefficient efficacy, but sometimes even if you have a great API, cannot even attempt to try to deliver it. Of course, over the last decades, past years, there has been a lot of interesting technologies, including nanoparticles, microneedles, and other invasive methods. But still, it bears a lot of challenges. For example, it can deliver drug into the inner layer of the skin, but once it is released into the skin, its delivery is still a huge challenge. Imagine, what if there is a technology that that is more patient acceptable, friendly, non-invasive, and if it can deliver API to the cell, and if we can do a cell-to-cell-to-cell-to-cell transfer until it reaches its target in a scavenging manner. And imagine if this technology can not only bring in the small molecules, but also biologics, including peptide protein, siRNA, and even a full-length antibody that would really push the limits of dermatology. And now I'll introduce our technology. Well, the TSDT platform technology utilizes the cell-penetrating peptides, a short amino acid long sequence that brings a cargo molecule intracellularly. But unlike the commercially available and ordinary CPPs, Celliver's hydrophobic CPP has another uniqueness. So cationic CPPs, how it goes into the cell is through endocytosis. So via endocytosis it enters, but there is not an efficient exocytosis mechanism. What does that mean? Well, if the API goes into a cell, it gets trapped in the cell, and there is no cell-to-cell transfer. So in terms of delivery efficiency, it's quite limited. Whereas Celliver's technology, we use hydrophobic CPP. It does not utilize endocytosis, no membrane-mediated transporter or receptor, but it's a direct penetration. So it goes into the cell via direct penetration mechanism. With exactly the same mechanism, it moves on to the next adjacent cells. So the key feature of our technology is cell-to-cell delivery. Let me show you a simple diagram to explain our mechanism. So CPP, as you see on the right, it's a cell-penetrating peptide fused to a cargo molecule. It's a direct penetration, so CPP goes into a cell and brings a cargo directly with it. And once cargo binds to its target, it stays. To help your understanding, let me show you an animation. So again, the red part is AMTDR CPP fused to a therapeutic molecule. Direct penetration. Once it goes into a cell, no target for the therapeutic molecule or cargo, moves on to the next adjacent cell, goes in, the therapeutic molecule binds to the target. I mean, in the animation, there are only 2 cells, but even if there are 10 cells, let's say, the phenomenon stays the same. So cell to cell to cell to, I don't know how many times I've counted the cells, but until the last cell that should be delivered, it travels throughout. So let me show you some POC material with our ICE-PNI, an agent for atopic dermatitis. The idea is quite simple. Again, we have AMTDR proprietary cell-penetrating peptide. We fuse it with a nuclear localization sequence, NLS. And how it works is ISPNI binds to important alpha and prevents the stress-responsive transcription factors to internalize to the nucleus, and as a result, it prevents the release of the cytokines. This is some key concept data. So treatment of ISPNI prevented the localization of SRTFs in the nucleus. On the right, on the left, the picture shows that compared to the diagonal group, where these SRCFs are internalized with the ISPNI, it is not. And cell permeability, of course, this is an important concept that we want to test. So in the keratinocyte, it is cell permeable. Dermal transduction is also possible. So in this case, we've used AD mouse skin, so atopic dermatitis mouse skin, and we have tested whether dermal transduction is possible. Some efficacy data. So in the DNZB-induced AD models, we have shown that ISPNI treatment recovers the skin barrier, shown by the flagrant signal, and also ISPNI in a cream formulation recovered severe AD light skin lesions, also restored the epidermal thickness, and looking at the MOA of ISPNI, it prevented the mast cell infiltration when we count the mast cell numbers. What about the helper T cell infiltration? The cream formulation prevented the helper T cell infiltration, which correlated with prevention of the expression of IgE and also the pro-inflammatory cytokines in atopic dermatitis mouse models. These were some of the concept studies that we've done with this atopic dermatitis agent. But again, for this pitching event, what I want to bring to your attention is not the efficacy of ISPNI, but then this innovative technology which can be applied to different biologics. Reading the trend of dermatology, I know there have been many biologics now. It has been developed like interleukin-13 by Leo Pharma. And so with the trend shift, I believe TSDT platform technology can shine. So AMTD peptide, siRNA, antibody, single chain antibody, whatever the payload that you want to deliver, we can help you with that. So some of the POS material again, AD mouse skin with the S injection. Here we're showing the AMTD single chain antibody and the full-length antibody of about a size of 150 kilodaltons. And we were able to deliver it into the cells and through the skin layers. Another advantage of using our technology is not just a cell-to-cell permeability. But from that feature, what we can do is we can make different formulations, because no matter where the drug is released, it does a cell-to-cell transfer until it finds its target. So delivery strategy for the field of dermatology is we can apply TSDT platform with therapeutic payloads, so in this case biologics, again like the antibody or the protein. And we want to develop it as a different formulations as per the need. So cream, gel, topical spray, injection, and moreover the oral dosage, the oral capsules or tablets, so that even if we take the drug as oral capsules, point of the release, from then on it will travel cell to cell to cell to cell until it reaches its target. We believe this technology can open a new paradigm to the field of dermatology. Thank you.
Thank you for your great presentation. Now we'll take questions from the judge panel and have a Q&A session for 5 minutes. Judge panelists, please raise your hand if you have any question. So we'll take question from Dr. Kuroda first. Please go ahead. 1 second.
All right, Kevin, thank you so much. I like your presentation very much. First, I have many questions, but first question is about side effect. I think your technology is great. You know, you can reach to the cells that you want to, but also if you inhibit nuclear import in general, it could cause also side effects, strong one. You know, there are like wanted nuclear import which will require to for cell proliferation, for example. Like, can you comment on that? Have you tested side effects?
Right. So side effects is a question that I always get questioned. So in this case, important alpha is the target, but what I want to focus is the cargo that we really want to deliver and the condition of it. So for example, in a patient with atopic dermatitis, there may be an overexpression of cytokines, there will be an overexpression of the important. So by finding the appropriate dosage, we want to deliver the peptide and we want to make sure that it is enough dosage not to cause the side effects. And with the POC materials, we have not only done atopic dermatitis, but at a IV and systemic delivery. And of course, there's a lot of important alpha and a lot of cytokines in the body. And in the case of inflammation, it's all over the body. But make sure we pick a disease that has only our target being overexpressed. So I think that way we can deal with the side effects. Thank you.
Is there any other question, judges? Yes, please go ahead, Dr. Labuda, with your question.
Yeah, thank you very much for a great presentation. I'm curious a little bit also about this technology. The way I understand it is that perhaps the biggest advantage would be that you could decrease the dose of the API that you're using. Is that correctly understood?
Sorry, let me rephrase your question. So increased dosage, meaning with the same amount of material being injected?
No, I mean decreased dosage.
Decrease the dosage. Yes, I would assume so. So far, we have we don't have a comparison data. The reason is, without the AMTD peptide, the control doesn't even not penetrate a single layer of the cell layer. So it's really hard to quantify how much increase it gives, but generally, when we have AMTD...
I was thinking about in the terms of oral or injections, administration, and in this case, I mean, normally you would see using an antibody or any other oral you would still have a dose that is sufficient to achieve what you're looking for, right?
Right.
So my question is, actually, if this technology would decrease the amount of drug that you actually need, and in that case, the cost of goods.
Right. So in terms of subcutaneous injection, we do see a decrease in dosage. It's by tenfolds, but it really depends on what kind of that drug that you're trying to deliver. But generally, it does, by many folds, decrease the dosage for sure, because it increases the efficiency of delivery.
Is there any other question, judges? Dr. Urso, please go ahead with your question.
Thank you for a very great presentation. I think we definitely are looking very much into delivery, especially with maybe some of the alternative mode of actions. So the antibodies might as well, but I think some of the newer formats. And I'm just wondering how, don't you think that oral delivery will still be difficult because you make a much bigger molecule than we normally have with a small molecule plus the peptide? And how does the hydrophobicity affect the function of the small molecule, if you have any data on that?
Right. I do not have any data on this presentations like that, but oral, honestly speaking, the oral delivery compared to the IV injection or subcutaneous injection, its efficiency does go down. I cannot say it does not. But then the important point is that even though efficiency goes down, it can be done with the large molecules, and we are currently doing the POC material or POC studies with the antibodies. And the idea is that, let's say, if it's released in the intestine or the blood system, what it does is that it goes into the blood system, and because AMTD protein has cell permeability, it actually escapes from the proteases in the blood system because it goes cell to cell. So when it's in the cell, it's not in contact with the proteases. So it sort of escapes and be delivered to the target organ, and only in that sense, our platform makes oral delivery feasible and efficient.
Okay, our time for Q&A session is up. Thank you again. Please go back to your seat. Now let's quickly move to hear from Taekyu Chung, CTO of Incos Farm. Please welcome him with a big round of applause.